Hi, welcome, and thank you for allowing me the opportunity to speak to you today. We're going to talk about COVID-19 and what we need to know for return to school. So what we know now and returning to school. My name is Thomas Trojian. I'm at WellSpan, Family Medicine and Sports Medicine, professor in the College of Medicine at Drexel University. And I've helped with Drexel's COVID team prior to me coming to WellSpan. Let's start with the beginning. COVID-19, it stinks. It's awful. This whole idea of having to wear masks and the whole process of social distancing and not being able to go out to eat dinner, it's not a good thing, but it's important. And we'll talk about how to stay safe and what the virus is and what to look for ahead of us. So COVID-19 is the coronavirus. It's a novel coronavirus discovered in 2019. Hence, it's got its name COVID-19. It's the second type of SARS type virus. So that's where it gets the second name, SARS-CoV-2. As you can see, the virus has envelope coating and then RNA. It's a special type of RNA virus that has spike glycoproteins on the coating. And that's where a lot of the vaccines that we'll talk about are targeting as well. People with COVID-19, you need to watch for symptoms. And these symptoms are fever, cough, shortness of breath, chills, repeated shaking with chills, muscle pains, headache, sore throat, and a new loss of taste or sense of smell. You can have rashes, especially in the younger ages, something called COVID toes. It's a rash that you see with viruses that cause vasculopathies like COVID-19. Symptoms can be mild to severe. More often in teenagers and middle school kids, they are mild. And they take 2 to 14 days to show up after virus exposure. Flu takes less. A virus like mono takes longer. And COVID most of the time takes in between around 6 to 7 days, but it can show up quick at 2 and slower at 14. So as a teacher, when to send to the school nurse? Well, definitely students with fever and a cough. Definitely if they have fever or shortness of breath, or if they have a cough and shortness of breath. Those would be key times to send them to the school nurse. Here in York County, we've seen the rates are much less than other places like Philadelphia, where they have 4 times as many cases per 1,000 people. Recently, we've had a slight uptick, as you can see the blue line starting to rise in the county. And that's why it's important to keep vigilant and still wear our masks and practice social distancing. How about in kids? Kids don't make up a large percentage. 15 to 17% of the population are kids, but only 6% have tested positive for COVID-19. Doesn't mean they don't get it. This means that they don't get it as frequently as adults have been. What does 6% mean? About 4 to 5 kids per 1,000 will have tested positive in the last 6 months. Not many kids have died from COVID-19, but they do develop this myocarditis, which is an inflammation of the heart, or they'll develop chronic fatigue. That's been in the low percentage, somewhere around 5%, varies by the study in the area. But that's important because that can be long lasting and prevent further exercise or activity. So it's best just not to get it, and hopefully we can get a vaccine soon. There are asymptomatic people, and especially with teenagers and middle school, about 40% of COVID-19 show no symptoms. At the beginning, we thought it was less than that, but more and more studies, like the Italian citywide study where they tested everybody in the city, in a small city like the size of York, and found out that 40% of the people who were COVID-19 positive had no symptoms. They also, through different studies, have found about 75% of the transmission is from asymptomatic people. So if 4 to 5 per 1,000 children aged 5 to 17 have tested positive, therefore, thanks to algebra, thank you all your math teachers out there, we can estimate that 6.6 to 8.3 kids per 1,000 kids between the ages of 5 and 17 have had COVID-19. Therefore, masks and other protection are important. What can you do? Well, you can avoid people, direct contacts 6 feet apart, cover your nose and mouth, keep your hands away from your nose, wear a mask when you're around other people, and clean surfaces. Stay home if you're sick, and then wash your hands. Testing is done by a nasopharyngeal test, and that's a swab up the nose. You need to keep the swab there for about 8 to 10 seconds, and it feels like somebody's picking your nose, so it's not necessarily a fun test to do, but it's not painful. You can also get a plasma test that tells you if you've been exposed to the virus. Now, not perfect, I agree, but it's what we have at the moment, and it's best done if it's 4 weeks after you've gotten sick. Lets us know if you have antibodies, and you might be able to help other people. Saliva test. Rutgers has developed a saliva test, and so have other people. It comes back in about 24 to 48 hours. It's not as good, it's not as sensitive as the nasopharyngeal test, and there's a limit on how many they can make, so it may not be available in your area. Other people have used the saliva test, and I know schools like Ohio State University has used the saliva test. So what's some information about the virus and the viral response? You know, initially in stage 1 infection, you'll get sick, and you might have fever, some dry cough, or headache, diarrhea. And then your body reacts to that virus in your body as it replicates and take over your cells. Unlike strep, which doesn't need your cells to grow, this needs your cells. So you then get an inflammatory response. You can get hypoxia or low oxygen, shortness of breath, and your chest x-ray will start looking abnormal. If you get really a big inflammatory response, that's really when people get sick. They get acute respiratory distress syndrome, they'll get cardiac failure, and get inflammatory markers will rise, and they'll get some clotting in the body. That's where medicines like remdesivir, corticosteroids, and IL-6 inhibitors stop that reaction. It's blocking the reaction to the virus that helps prevent people from dying. What about a vaccine? A vaccine is going to help us a lot. 120 different projects around the world. Currently, we have 7 in phase 3 trials. Phase 3 trials are when they start putting them out into people and they think they're safe, but we're going to test them on people. Russia skipped that last step. You may have heard recently that they're moving forward to mass vaccination, and hopefully it's safe. We're probably months away in the United States. The U.S. Department of Health and Human Services recently purchased 1 million doses of Moderna's vaccine, which the NIH has been helping with production. And hopefully that vaccine turns out to be safe and will be good with the vaccine, and that'll be good for everyone. But what if you do get sick? How long are you going to be viral spread? How long are you going to be able to be safe to return to people? Well, people with mild illness have infection from 7 to 9 days. They're still contagious, and very few, but some people even longer. And then if you're really sick, get into the hospital. It can take much longer if you have a lot of virus. So the CDC says, you know, you can be around people after 10 days that you've been sick. And these are all important. You need to have all three. No fever for 24 hours and improving symptoms. So your cough is getting better. Your shortness of breath is getting better. Now your loss of taste or loss of smell, that may last for a long time, for weeks or months for people. Some people have noticed some memory problems and skin rash. They take much longer. We're talking about the cough and the runny nose for symptoms. So your symptoms need to be improving. No fever for 24 hours without Tylenol, naproxen, Advil, and 10 days since your first symptoms appeared. So what can schools do? Well, especially in the administration, communicate, educate, and reinforce. You know, you need to reinforce appropriate hygiene and social distancing. Need to be done appropriately for the students and elementary teachers and staff. So it's going to vary by each school, and you're going to need to find the best way to communicate to your group of people. When you're indoor, yes, people have said that if you're far away, you can take your mask down, or if you're alone, you can take your mask down. But still, the best is to wear your mask indoors, social distancing, and hand hygiene. Educate parents and caregivers on the importance of monitoring at home so that kids aren't sent to school sick and then contaminating people. So wash your hands often is key to decreasing the spread of COVID-19. Avoid close contact, stay 6 feet apart. That's because the virus is spread by when you talk or cough through water droplets that are pushed out, and they usually start to fall to the ground by 6 feet. Cover your mouth and nose with a mask when others are around, and it's important to use the mask properly. Cough into your elbow or a tissue. Clean surfaces. You know, in a class, cleaning the desk after the kids have left is very important. Cleaning the area, cleaning door handles a couple times a day can help reduce the spread. And then monitor your health daily, you know, and making sure that the kids are monitoring themselves for illness, fever, cough, shortness of breath, any of the symptoms. So what can you do as a teacher individually? Send a welcome email or call parents. Let them know that you're there to protect their students and their kids, and remind them to stay home if they're sick, and if they've been around anyone who's sick, to self-isolate. You could be a role model. Wear your mask, making sure that you show how to wear a mask properly. It's important because as you breathe out, that water vapor hits that mask and decreases the spread to other people. Also, as you breathe in, a good bit of the air will pass through the mask and the water vapor will hit the mask as well, those two layers, and reduce the amount you get. But the large effect is you breathing out to other people. That's why covering the nose and covering the chin is important. Keep your hands clean. Use a hand sanitizer with 60% of isopropyl alcohol or ethanol alcohol. Methanol is dangerous. It does get absorbed through the skin. So make sure you're using an approved hand sanitizer. And then the other option is washing your hands for 20 seconds. Row, row, row your boat twice. Singing that can be very helpful. What can WellSpan do? Well, WellSpan can do a lot. We have wellspan.org, online urgent care, and you can use the promo code COVID-19. Or you could search WellSpan and Community Toolkit. We have resources for the community partners, that, including posters, handouts. So we can be of great help to you. Thank you for listening. COVID-19 hotline from WellSpan, 855-851-3641. This has been Dr. Thomas Trojian, and I'm glad and happy to help out in any way possible, and we're glad that your school has asked us for help. Thank you.